Hey everyone, Dr. Bodle here. Now, secondary hypothyroidism is something that is well defined in the literature, but it isn't considered to be an important clinical factor for most docs. However, these issues can lead to thyroid symptoms in some people, and in others, it can make existing thyroid symptoms worse. So for today's video, we're going to look at secondary hypothyroidism, what it is, what causes it, and why it can make thyroid conditions more difficult to manage and assess. Now, as we've talked about before, typical hypothyroidism is defined by the presence of low thyroid symptoms in combination with an elevated TSH and low T4. But to be totally clear, we should really say that this pattern and presentation applies to primary hypothyroidism, meaning that the cause of the hypothyroid symptoms is due to something wrong with the thyroid gland itself. However, because it's the most common cause of hypothyroidism, that part often gets left out. But the other thing that you know if you've been watching my videos is that people can still have legitimate low thyroid symptoms even if they don't match the traditional definition of hypothyroidism. We need to be able to produce thyroid hormone, transport it, convert it into its active form, and bind it to the cellular receptor. And if we have a break anywhere in that pathway, then we're not going to be able to have that last step take place, which will lead to a decrease in metabolism and the presentation of symptoms. When it comes to secondary hypothyroidism, the problem is with that first step, the production part. However, instead of the issue being with the gland, instead, now it is with the brain. To produce proper amounts of thyroid hormone, we have to have communication between the pituitary gland and our thyroid gland. And if our pituitary isn't producing proper amounts of TSH or thyroid stimulating hormone, then the gland won't be stimulated and it won't release hormone. The thyroid really isn't thinking for itself. It's waiting for messages from the boss. And if it doesn't get that proper signal, then it's not going to do something that is out of turn. So if we have damage to the brain or an interruption in the way that the brain works, we're going to have a decrease in signal production and therefore a decrease in thyroid hormone release. This is secondary hypothyroidism. The thyroid hormone is low in the bloodstream, but the gland itself is fine. The issue is that the brain isn't stimulating it properly. This can present on our labs with TSH that is normal, low normal, or lab low. And that's found in combination with free T4 that is low normal or also lab low. So instead of having the traditional primary hypothyroidism pattern of high TSH and low T4, we now have low TSH and low T4. In both scenarios, we're not producing enough T4, but the problem is coming from different areas. I like to refer to primary hypothyroidism as a high-low pattern and secondary hypothyroidism as a low-low pattern. But if our thyroid gland is mostly intact, and that's not 100% true, we're going to come back to that here in a little bit because, as you guys know, conditions can overlap and we can have more than one thing going on at a time. What is the primary driver here? Well, for that, we need to look at conditions that can affect our brain. Now, research shows us that secondary hypothyroidism is pretty rare, affecting only 1 in 80,000 or 1 in 120,000 people. It usually involves conditions that are very severe, and for that reason, those conditions tend to be the primary focus of treatment, and even though the thyroid is suffering, it's more of an afterthought. But it's possible that either due to the rarity or due to these other conditions being so dangerous, most of the time, secondary hypothyroidism isn't on a lot of doctors' radar. And just to give you some examples, if secondary hypothyroidism does come up to a doctor, they're thinking about things like brain tumors, malignancy from breast or lung cancer, injury from radiation or surgery, inflammation from things like iron overload, and brain injury, either from something traumatic or something vascular like a stroke or aneurysm. So now that you hear these, you can see how a lot of the time, the standard approach is going to be addressing the stroke or the cancer, and the thyroid symptoms tend to get pushed to the side. However, in my experience, we can still have secondary hypothyroidism occur in absence of those more severe conditions. This can include more mild brain injuries like concussion or TBI, or even brain autoimmunity. It might be caused by someone who isn't having a stroke right now, but who has a history of strokes or ischemic events. It can also occur in people who have chronic fatigue and adrenal changes because they can't get proper fuel to their brain. And along the same line of thought, It could be associated with someone who has a metabolic condition like diabetes or something like anemia. Again, these things aren't as acute or dangerous, but due to their chronicity, they can still change the way that the brain works. So if we now have these changes in brain function that are less acute and more chronic, and they have the potential to contribute to thyroid symptoms, then the thyroid symptoms are much more likely to be problematic for the patient and therefore need to be addressed. And if we don't understand these kinds of patterns and these kinds of multifactorial webs, then we're going to miss the mark in terms of supporting the patient in the way that they need it. But hopefully everything's making sense so far and you're finding the information to be useful. But before we move on, I just wanted to give you a quick reminder that if you are enjoying things, please remember to like and subscribe. And if you have any questions, leave me a comment down below. I really do appreciate the support for the channel, and I also enjoy having the dialogue back and forth. But finally, why does secondary hypothyroidism make thyroid conditions so difficult to assess and manage? Well, like we said before, you could have all of the classic thyroid symptoms, but most doctors are only going to look for an elevation in TSH. If you don't have the standard presentation, then it doesn't matter how many thyroid symptoms you have. It's instead something that's probably just being imagined by you, and you're going to need to see another doctor. But if we know that that approach only works for primary hypothyroidism, then we're going to need to look beyond the elevated TSH. As you guys know, I always advocate for a full thyroid panel, and I'll link for you in the cards above my video where I break down every marker. But if we break it down to a more simplistic approach, this is one of the reasons why I really don't like the lab order of TSH with reflex T4. Essentially, this is a way to reduce inefficiencies and save money because the T4 will only get ran and checked if there's abnormalities with the TSH. But what if the TSH is trending low? Could you still have low T4? Well, if secondary hypothyroidism is in play, then the answer is yes. But the way that this can get more confusing is, let's say you do have some form of primary hypothyroidism, the most common of which is an autoimmune condition called Hashimoto's, where our immune system attacks and damages our gland, impairing the way that it works. Normally, this condition would decrease the amount of thyroid hormone that's produced, and the brain would respond by increasing TSH. But now let's say you experience a brain injury on top of your pre-existing Hashimoto's. The normal response of the brain is to increase TSH when the thyroid isn't functioning. But if it's injured, it might not be able to do that. This is why I mentioned earlier in the video that some people with secondary hypothyroidism can have normal TSH. It doesn't really make sense unless we think about the fact that there can be multiple things going on at one time. If we have a condition that tends to elevate our TSH, combined with a condition that can decrease our TSH, then you have a tug of war that might end up with TSH somewhere in the middle. But this is why it's so important to look at things holistically, look at all of our thyroid markers, and assess different points in our life where our health has changed. So if you've had some sort of injury, metabolic condition, or chronic stressor that has changed the way your brain works, leading to neurological symptoms that were eventually followed by thyroid symptoms, then we need to start thinking about secondary hypothyroidism and looking at that TSH a bit more closely. Because some people will have low T4 values as a result of the low TSH, some will need thyroid hormone replacement medication to help resolve those issues. Others might have low normal T4, and therefore medication may or may not be appropriate. In those situations, it can be better to look at the brain itself and figure out ways that we can support it. As always, we want to identify the mechanism and match our therapies to that mechanism. If the brain isn't working right because of something metabolic, like diabetes, anemia, or gut inflammation, then our strategies might be more nutritional or supplemental in nature. If the dysfunction is more injury-related, then it might be appropriate to see a vestibular specialist or a chiropractic neurologist. And keep in mind that lifestyle can almost always play a role, whether that's mild or whether it's a main trigger. Consider things like stress overload, poor sleep, or lack of physical activity. I realize that it can be a bit frustrating to say that there isn't one way that we should approach secondary hypothyroidism, but there isn't. And this is again why we always need to look at the big picture and identify what your personal needs are. My hope is that these videos provide you some more context and additional therapies to consider. But as I said before, if you have any questions, definitely leave me a comment. Usually when I go over this topic with patients, it's one that they're not always familiar with, so I'm happy to discuss things further and provide any additional clarification. If you like this video, but know that you need more individualized care and support and would like to work with me one-on-one, then you can start that process by sending my office an email at contact@seattlethyroidhelp.com. All you have to do is put consultation in the subject line, and once my staff receives your message, they'll see if you qualify for a free consultation and help you to get scheduled for that. During the consultation, you and I will sit down, talk about your symptoms, talk about your goals, and see if we're a good fit to work together. I always want to make sure that you're in the right spot for you, you get all your questions answered, and your symptoms are something we can help you with. If you're not sure about the consultation right now, but want to keep learning, check out some of my other videos on the channel, any of my testimonials, or grab either of my free downloads down in the description box. But that is it for today. Love you guys, hope you're doing well, and remember that I'm here to support you. If you liked the video, give it a thumbs up, subscribe to the channel, ring the bell, and if you want daily information, you can follow me on social media. Links for Instagram and Facebook are down below. But my name is Dr. Brad Bodle. I hope you guys have a great rest of your week, and I will see you in the next one.